Hi, and welcome to episode 187 of the Untethered podcast. Today we have Kathleen Dung joining us. Kathleen is a speech-language pathologist and Southern California native currently working in an outpatient setting in a community hospital in California. She has a passion for pediatric dysphagia and has experience across the lifespan in the schools, skilled nursing facility, private practice, and inpatient settings. She loves to cook, spend time with friends and family, go to the beach, and all things outdoors. She happened to be a student who took our first inaugural Feed the Peds course back in March 2020. And so I'm super excited to dive into this episode so you can hear all about her journey ever since. Quick disclaimer, all information, content, and material of this podcast are the opinions of the speakers and is for the informational purpose only and not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified healthcare provider. Welcome to the Untethered podcast. I am your host, Hallie Balkan. I'm a certified orofacial myologist, feeding specialist, and mentor. This podcast is all about getting your questions answered and collaborating with colleagues to bring you the most up-to-date information in the orofacial myofunctional therapy, tethered oral tissue, and airway space. I challenge you to keep an open mind and join my mission to get this information out to the masses. Let's get started. Kathleen, welcome to the podcast.
Thank you so much. I'm so happy to be here.
I'm excited too. So for those who don't know, Kathleen was in our first Feed the Peds course back in March 2020 when the world shut down. And it's been so fun to see students who were like, you were just out of school, right? At that point?
Mm-hmm. Yeah, I had just finished my master's and I was just starting my CF.
Yeah. And I know everybody was kind of like, what do we do now? Like the world is shut down. We don't know if it'll be like 2 days, 2 weeks. Like there were so many unknowns. And yeah, so it's been really cool to see the journey, especially now that we're like 2.5 years out from like when the course started, to see the journey of how some students in the course, including yourself, have evolved. So I would love to just chat about your journey because I think it would be really helpful for other, clinicians who are either in grad school or early on in their career, or even someone who's possibly looking to like make the jump into pediatric feeding. I would love to know, did you have any big takeaways from taking the course? Like anything that you were like, wow, I wish I had this in grad school, or, anything that like sticks out in your mind?
Well, I wish I had the whole course in grad school.
We all do.
Yeah. I feel like it's just now starting to become part of the curriculum because all the dysphagia I got was mostly adult geared. I had maybe 2 lectures that were for pediatric dysphagia, and I was like, wait, I want more.
Yes. I don't think I had any. I had 0, like no ped dysphagia at all. And it was so interesting because I feel like it was a program where we got such a great view on like peds and adults throughout most other areas. So the fact that like the dysphagia courses were so heavily focused on adults with like no recognition of pediatrics was very fascinating. And I was kind of like, I like this, but I don't want to work with adults. So okay, moving on.
Yeah, exactly.
Yeah. So tell us, so you came out of school, obviously the world shut down, the pandemic started, you jumped into the course, like what's happened since then?
So since then, I worked at a private practice where we served a lot of little ones with pediatric feeding disorders. I kind of got my feet wet there with some of the school age kiddos and kind of backed into the younger kids and did a lot of observations with lactation and some bottle feeding. And then I had the opportunity to work in a community-based hospital setting, which is where I am now. And I do a lot of early intervention and a lot more bottle feeding, a little bit of lactation. A lot of transitional feeders come to see us. So it's been crazy.
Yeah, you've had quite the ride. I mean, it's so cool to see somebody step into this so early on in your career. Cause I always tell everybody, I'm like, I feel like I was thrown in, like I was interested, but I went to the schools and I was like, cause I started in the schools and I had a 3-year contract and I was like, hey, I want to do home health. Like I want to do infants and toddlers, like send me that way. And they were like, well, you didn't have that experience in grad school. So no, like you can't go that direction. And I was like, "Ugh, I don't like being told no. Like that's what I really want. This is like not going to be fun." So I started and they gave me like preschool only, which was like unheard of. My entire schedule, full-time schedule was like, I was split between 2 preschools in the county-based preschools. And so I was at least grateful for that. But I was like, okay, can I do feeding? And they're like, no, we don't do feeding. And then all of a sudden a therapist in one of my schools went on maternity leave and I inherited her caseload, or parts of it at least. And one of them was a medically complex, like, kiddos, like a medically complex based classroom. Like these kids had their 24-hour nurses with them. And here I get IEPs with feeding goals on them. And I like walk in and they have the kids' necks in extension. They're pouring food down their throat, and I'm like, okay, I don't know a lot, but I know that is not safe. Like, what is going on here? So I quickly also just threw myself in my CF year to starting taking as many CEUs as I could get my hands on. And it was so hard to find applicable information. I was like, I just want someone to give me a comprehensive course so I can get started, and then I'll continue to take more. And yeah, so that was my pain point in the beginning, where I was like, oh, I wish I had Feed the Peds 12 years ago, but here we are. So yeah, it was a journey. And over the years, then I've also evolved into working with different populations, and I've had some fun ones. At one point I was really into working with children on the spectrum, and I loved the challenge and getting, figuring out their best ways of communicating. But then I started to notice their eating patterns and their stomach troubles, like constipation. And then, and I was like, okay, this is interesting. And that threw me down another rabbit hole. And then I had my first child and I fell down the Tatsumayo rabbit hole, and here we are. Here we are. So do you find, are you doing tongue tie assessments? Do you find a lot of mouth breathing babies? Or are you doing, are you seeing different things where you are?
So it comes in waves. There's months at a time where we get a lot of tongue tie assessments. But I mean, throughout my practice, when I'm even just evaluating kiddos for language or speech sounds, I notice all of that, and I definitely incorporate what we learned in the course and through courses that I've taken after into my practice, and just help explain things to parents in a different way. And I've had one parent in particular say, oh my gosh, it was like a light bulb moment for her. It makes complete sense that, someone with the skills that her son had obviously has difficulty making speech sounds because his tongue's not strong enough, or he doesn't have the range of motion. So it's nice to figure out and talk about the why, instead of okay, they're just not making the sound, but I can't really give you a reason.
Yeah. Well, and I think it's, if you can be relatable with parents, right? If you can help connect the dots, because it just feels like we get so many parents, even little ones, where they're not talking, or I don't understand what they're saying, and other people don't understand, or I understand, but other, their teachers don't. And I feel like those are some the most common referrals we get, are either speech or feeding based, and they're very obvious things, right? And then you kind of dive a bit deeper to look at well, what's the root cause? What's connecting all of these either delays or, disordered, speech or feeding or whatever, language, whatever is going on. And you start to look full body impact, we talk about, and you start to go okay, there's a little bit more going on here. We can totally address this. And I think when you make those connections for parents, are whoa, why has nobody else ever told me this? And oh yeah, I mean, it would make sense that the function is impaired. Obviously, we don't use these words necessarily, but or the parent won't say this back, but the function's impaired because anatomically, they can't do it, or we need to teach them the skills because of these, they're using compensatory skills right now. So yeah, I think that the best clinicians are those who connect with the families and make it easy to understand what's going on, why function is impaired, and how are we going to work on this together, right? And I feel that was lacking so much back like when, I think I first started, especially being in the schools, like with IEPs, like it was hard to communicate with a lot of the families. And I'm like, I wish I could just like have a 5-minute conversation and like learn a bit more about what they present like at home. And we tried, but anyways. So yeah. Do you find that like the families where you are very interactive? Do you have like a mix? Like what's been?
Yeah, I feel like wherever you go, you'll always have a mix. You
Yeah.
have some families who are super involved and they'll email you like twice a day with questions. And then you have other families where it's like, okay, let's see if we can like tweak things just slightly so that we can make a little bit of progress this week.
Yeah. Yeah.
And trying to figure out what works best for the families and how you can best support them and their kiddos versus like having this goal and knowing the steps that you need to make towards that goal and trying to have the family kind of fit into your plan.
Yeah.
Making it a little bit more integrated that way.
Yeah. And that's the skill that I feel like for some of us feels like so obvious, but I think that it's so very much so lacking in our industry. And because we have parents come to us and they're like, wow, no one ever explained like they were kind of doing the same thing at the last place, but no one really explained to me why they were doing it. And like, now I get it. Now it makes sense. And, and so parents will leave if there isn't clarity, like they'll want to stop therapy. And so I think also getting like, for those who are interested in being involved, like getting the involvement also has a lot to do with like how they connect with you and how they see their child connect with you. So yeah, no, I love that. So for a new grad or somebody coming out, do you have any like, or not coming out, but someone like coming out of grad school or their CF, or even just again, wanting to transition, even if it's not feeding, like just into another maybe specialty area within the field. Do you have any like tips or advice or anything you feel like you did that was like really beneficial to you?
Yeah. So when I started taking the course, I told myself, I'm going to push myself to be better, especially after your first module where you said, be that person that you want to be. You are a pediatric feeding therapist. I tried to ask questions where I felt like I couldn't Google the answer, and it came through experience or mentorship, and just be curious and always learn and always push yourself to grow, because we're never done learning and you're never done growing. And just putting yourself in that mindset that you're not always going to know the answer, and that's okay. And that's where you go to your colleagues and other people in the field and your community, like on Facebook. I love that. We can always ask each other questions there and get lots of different perspectives. To keep growing and be a better therapist.
Yeah, I love that. And I don't know if you were in like the free training that I did the week before I launched the course, but like you would remember this from 2.5 years ago. Are you familiar with the Dunning-Kruger effect? Do you know what that is?
I vaguely remember it.
Yeah,
Remind me.
I always bring it up because I'm like, it's that. And I'm going to like butcher it too, because like this just like fell into my brain randomly, but it's basically where like, like a new grad graduates and you're like, I'm on top of the world. I know everything. Like, let's go. And then people who've been in the field for like 10, 15, 20 years are like, I know nothing. Like, I just need to keep learning. And it's this interesting like effect where, sometimes we even enter into our field, like ready to take on our patients, kind of feeling like, okay, we're new, but also like, I got this. I got what I needed from grad school. And then it's like, you're sitting in front of the patient. You're like, I don't got this. Like, what did they teach me?
Yeah.
So yeah, I feel like we encounter so many speech pathologists who come out of school. Like I've talked to new OTs and, that are like, I don't know what to do. And it's so hard to find mentorship. And, I don't want to look stupid. And I'm like, look, like at the end of the day, none of us know everything. Like I don't know everything. People have been teaching for 50 years, who've been in the field for 60 years. Like they don't know everything. And I love how you said, like, always keep learning, ask questions, like talk to colleagues. I feel like that is the mentality that we need to have and carry forward. And I feel like I'm seeing a lot more of that in like the newer generations of graduates versus some of like the older generations that are like older than me. Because it was really hard when I came out, like nobody wanted to help. And even if I offered to like pay a mentor to help me when I was like, getting certified in Mayo or early on in my feeding days, like it was crickets. Like people just wouldn't respond. And I'm like, just say no, like just say no. So I know you're not like just totally ignoring me. It's so interesting. And that's also been like part of my mission, like elevation movement, like let's work together because these patients need us. And if we can't like elevate each other and support each other, then what good are we to the rest of the field and the patients? Yeah. So I love that you're like, saying to push yourself, continue growing. And I think staying curious and just like that, having that fire and desire to like learn more is one of the best things that like anybody can just kind of maintain as, that desire as you continue throughout like your entire career, really.
Yeah. And when I started this position, I got close to one of the older therapists who's been working here for, I think, 45 years. And I was talking to her about how, I have all this knowledge and this information, but I still don't feel like I know what I'm doing sometimes. And I need that extra support. And she was like, you know what, Kathleen, give it 10 years. And even then, you're not going to know everything and you're still going to feel this way.
Yeah. Oh yeah, no, it's so true. Like even 10 years in, 12 years in, I see a patient and I'm like, okay, well, I'm just gonna take some notes here. And this is just the evaluation. I'm going to ask questions and I'm going to go have some conversations with some colleagues and kind of figure out like, am I even the right, like next step, like, person to treat this child? Should I be treating them and making some other referrals? I mean, I feel like you always get cases where like, sometimes you get cases and you're like, okay, like I've done this. This is looking kind of like, like what I've seen in the past, like I can definitely help this family. Obviously every patient is different, but like you at least have like, you start to get like a general like groove with like certain, types of patients. And then you always get those patients who have like a diagnosis you've never heard of, or they present, like they come in with a diagnosis and they present completely different than any other child you've ever worked with. And I'm like, okay, what do we do here? So yes, it doesn't get better but I think that's also the beauty of what we do. Like it continues to challenge you. And that's what was exciting to me. It was like, it kept me on my toes. Like it keeps me learning, talking, trying to figure out, like at the end of the day, we're not treating to the diagnosis, we're treating to the child and the way the child presents. And I think that too, like just remembering that and seeing like what the child responds to, like that it's like a dance. I would say it's like kind of like a dance between like an art and science. Like you really have to like put that critical thinking cap on because you're like, okay, where are we going today? Yeah. So do you like, and I'm so curious because now that you're like a couple years out of school, do you plan sessions? Like, do you like sit down and like spend time planning like every single session for patients? Or do you kind of just like look at the notes from last time and jump in? Like, what do you do?
So it depends. There's some patients where I'm like, okay, I need a little bit more practice. I need more experience with this. I need to pull from these resources. And then there's some kids where like my school age kids or my picky eaters where I just do a lot of play-based feeding therapy. And I'll look at the notes, I'll see what they did last week, and then I'll maybe write down on a Post-it what I want to follow up on, and then we'll just go from there. And it's super fun every time.
Yeah, no, I remember like one of my grad school teachers saying something like, oh, the best therapist can just do therapy with whatever's in their purse. And I was like, what? Like in grad school, I was like, okay. And so she was like, let's open your bag. Like what's inside? And like, we pull out like a pencil. She's like, how would you do therapy with this pencil? We were like, well, who's the patient? And she's like, doesn't matter. How would you do therapy? We were like, what? Like, and then as I, moved away from my earlier years as a therapist, I think I was probably like 4 or 5 years into it. I was still traveling to a lot of patients' homes. And I just remember being like, I can't carry all this stuff. Like my trunk is full, but like, there's gotta be a limit. And finally I was like, I don't actually need all this stuff. I had the nickname, the bag lady. People called me the bag lady because I like always came in with like the fun bags, toys and therapy materials and all the stuff. And so I would go into like some preschools and see like, a bunch of kids back to back. And anyways, so yeah, at the end of the day, like I was like, I mean, I can do therapy out of my purse. It's not always the most fun therapy when you're working with little kids. So, but yeah, I got to the point where like, I just wasn't planning anymore. I would literally like open up their file and their EMR at the beginning of the session and be like, okay, what did we do last week? What did I ask them to do over the week? Okay, great. Let's go. And that was like liberating.
Mhm.
It was so fun. So yeah. So what else, any other like suggestions if someone's kind of like nervous to jump into the ped feeding world because they're like fearful of working with the patients, or like I feel like I get that a lot. Like people are like, I don't want to hurt anybody. Like I don't want to
Mhm.
make the wrong choice and like hurt a patient because like this is medical. It's not like, playing games and building language, not to
Mhm.
downplay that, but
Yeah,
there's a
yeah,
medical component
exactly.
here. Any like advice as like a therapist now who's been doing this for a few years?
Yeah, other therapists who have more experience have always, talked to me about this too. It's okay to be scared. It's okay to be nervous. If you're not nervous, then there's an issue. you
Yeah.
know, um, taking the time to find a supportive team and find a mentor like you have and Feed the Peds, to use as a resource and to talk about cases and evals before they come, to have a good plan so that you feel confident and growing your skill set that way. I think is a really good place to start because, like you tell your patients, you need practice. If you don't have practice, you're not gonna get better or grow. You're just going to stay stagnant in the same place. So you need to do the same things, and pushing yourself is hard, but you feel so much better afterwards. And having this community and support system makes worlds of a difference in your practice. You're not only going to work with just whatever size team you're working with, you have all these other people, all these other therapists with different viewpoints and different experiences to help you grow and to help you learn.
I love that. I love that. And I love how you said, like, you should have a little bit of like angst or fear or something like when you're basically starting out. Right. And it's so true. Like they always say that like anything that you're not afraid of is like not worth doing. Like I always tell, cause I also do business coaching. Like I tell like business owners, even they're like, I'm feeling some like anxiety or I'm feeling like some fear, like creeping up, like, who am I to do this? Like, why me? Like, why me? And I'm like, look, like, that means that this is something exciting that you want to do and that you're pushing yourself forward and you're feeling this because it's new and it's like you're about to jump into something you've never done before. And obviously there's like different levels of like angst over things, but I love how you brought that up because when I see therapists who are like, I think there's a difference between being competent, confident, new, and still having like a little fear of like, oh my gosh, like, am I really doing this? And, starting and being like, doing right. But still then kind of growing into that confidence more and more. And on the flip side, it's like a very dangerous place to be if like ego is driving things and there's like this false sense of like self-esteem or self-importance because like, oh, I've got all the information and I know what I'm doing. And you've never actually touched like a patient a day in your life. It's I think when ego drives things, like that's dangerous. And so, yeah, I love that you brought that up because I think it's almost important that you have that and you recognize that everybody experiences that and it's okay. And if you didn't, like, we might be a little concerned.
Just a smidge.
Yeah, I mean, it's okay to be confident, but also like just be like a little bit like, like, oh my gosh. Yeah, no, I love that. I love that. So are there any other tips, anything we haven't like covered that you would say to a newer therapist in this space, whether they're new to SLP or just new to ped feeding?
Mhm. I mean, kind of like what you say when you talk about the course, invest in yourself. You're worth it. You're worth the time. You're worth the money. Um, you can do lots of things if you persevere and you push through and you have a growth mindset and know that you're not always going to have the answer. It's okay not to know. It's okay to ask questions. It's okay to be vulnerable, because that's how you better yourself for not only your own clinical practice, but your patients and serving whatever community you are.
Yeah. Yeah. Again, I love this. Like the whole growth mindset thing, it's like growth over comfort, right? Like you can either stay comfortable or you can grow. Like they don't really go together. And I think that when you can really truly step into taking on those challenges and learning from those, what's put in front of you, obviously you become more capable, you develop your skill set, you increase your confidence. And yeah, I think it's so rewarding. Like this space, like working with these patients, at least my experience has been that it's a challenge, but when you maintain that growth mindset and you just kind of push forward, like it's such rewarding work because you're literally changing like the future of that patient's life. Whether they're not able to get proper nutrition because of their feeding challenges, and now they can, they're developing their own motor skills, they're able to keep their mouth closed, maybe they got their tongue up, they can breathe through their nose, it's like all those beneficial side effects of like the work that we do too. I think it's so important to also like take a step back and like look at it from like, oh wow, like I've been doing this work like for a couple of years, look at how many lives have changed, like look how many lives I've touched, and that reflection I think is really important as well, because I think so many of us, like a lot of us focus on like go, 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 grow. And I'm like, okay, let's all pause and reflect as well. Because it's tough work. And like, I really do think you have to be a critical thinker to function in this space.
Totally. Yeah. And it's really easy with social media and everything to compare yourself to other people and think, okay, they're able to do this in this amount of time. And you can sometimes see the journey there, but sometimes they don't show you all of the difficulties and all the things that come with it and what it takes. So just trying not to put a lot of pressure on yourself to get there too soon and just enjoy the journey and enjoy the ride. Will definitely help.
I love that. And that whole piece of it too, like taking the time you need to take to develop your skills and asking the questions like we've talked about and allowing yourself to become a critical thinker, I think is so important, because like when you talk about social media, I get messages all the time like, hey, what are the exercises you do before a frenectomy? Hey, like, what do you do for this? And I'm like, it's not that cut and dry. Like I can give you some exercises. You're still going to have to figure out who needs what and who doesn't need what, and what else they might need beyond what I've given you, or what you might need to modify when working with a certain patient. It's like not, it's like I can give you a whole library of exercises, but that doesn't actually totally tell you how to do therapy. Like you need to know what you're doing, why you're doing it, what you're working on, what the end goal is, and like, how are you trying to accomplish that? And I know you touched on that earlier too, but that was like one of our big goals. I was like, I feel like I left all these courses and I was kind of like, I don't know what to do. Like I have some ideas for a couple patients, but like after that, then what? And I also think that was my mindset, like coming out of school was kind of like, well, just tell me what to do and I'll go do it. And, so I don't blame any therapist who comes and asks for that, but then I'm kind of like, pump the brakes. Like, let's have a conversation. Critical thinking. Like we seem to have lost like this whole, like even me, I was like, we seem to have lost the ability to be critical thinkers, like analyze what's in front of us and create a treatment plan based on the patient, not like a protocol. So yeah, that was like a big, big goal of ours. And I'm hoping that it's evolving more in our industry again.
Yes.
Do you feel like it was something like coming out of the course? Do you feel like you were able to kind of look at a patient and like have an idea of at least how to assess and maybe where to start treatment? Like where were you with that?
Yeah, I definitely felt like with the really simple cases who weren't really medically complex, I could figure out a plan for assessment and treatment. It was the more complex kiddos where I was like, okay, wait, I know what to do. I need help.
Yeah.
This is what I'm thinking. What else are you thinking of? And what else can I do to make sure it's a thorough assessment and they're getting good treatment and I know and can feel like I'm doing a good job.
Yeah. Yeah. And I think that that's part of it too, right? It's like it is like a two-way street, right? Like you're helping the patient, but it's also like the work we do feels really good, especially when they're, making progress and the caregivers are like less stressed and they're happy and things are moving in the right direction. And yeah, I mean, those medically complex kiddos, like they are challenging sometimes. And it's one of those situations where you're like, okay, like, are there any contraindications if we do this? And has anybody worked with this population? So I know if there are like certain things I should consider that I'm missing. And I think that's what makes pediatric feeding so complex too, because like, we don't always know when we get these patients that they have some of these other things going on. And sometimes it's like not until you like are already working with them and then like things start to pop up and you're like, wait a second, like what's going on here? Like, what, did I miss something? Was it just not super visible to me because I'm a newer therapist? And I will tell you, even, as a therapist, 12 years into it, it still happens. Like you get these kids, right? They come to you, maybe you're the first provider, maybe you're the 10th, but like they come to you, maybe they've got great history that you've reviewed, but there's nothing documenting like, that they have airway considerations. And all of a sudden this kid has like laryngomalacia. Like they come to you and you see it and you're like, there's something going on. I can't diagnose it. So I can't say it is or it isn't, but and then they go to the ENT and the ENT's like, they're fine. And you're like, they're not fine. And, and it's like this like dance of like,
Yeah.
okay, well, now what do we do?
Mhm.
Yeah. So
Yeah.
it still happens. And I think that that's where that critical thinking component comes in. Cause like, then it's like, well,
Mhm.
what is safe for this
Mhm.
child? And what do I feel comfortable, advising this family on? Like, what's in my scope? Who else can maybe see them? Like what, in terms of other specialists that maybe will help us figure out what's going on. And that
Mhm.
all, that all grows out of that critical thinking component of not just like, oh, I have to assess them and I have to treat them and dismiss them. And once they can kind of like drink, like they're dismissed. Like, no, not because they can, gulp
Yeah.
down a bottle despite
Mhm.
the surrounding symptoms or compensations. No, like let's figure out what's actually going on and try to like, dig a bit deeper, treat it from the root of the issue. But yeah, that's one of the things too that we've had a lot of feedback on. And so we're developing some more advanced
Mhm.
courses
Oh, I
now.
was gonna ask if that was coming.
It's coming. It's now the wheels are in motion. We're like kind
Okay.
of trying to nail down an outline and start to figure out who's going to educate, in some of these courses. And, but really, yeah, to dive deeper into some of these nuances and, and that will also be tied to a certification if people are interested, but we're figuring it all out because everyone's like, we need more. I'm like, okay, we're working on it.
Yeah. And I mean, when you get those complex kiddos too, that's where I'll go and collaborate with my PTs and my OTs and
Yes.
other physicians and school therapists and other people that they're seeing so that it's a really comprehensive treatment too.
Yeah. And that's so important. I mean, it's like if I haven't drilled that into everybody's head, like either through the course or my podcast or whatever, I'm like teamwork, collaboration, like figure out, and it just, I always, like I've shared this, I feel like a couple times lately on recent podcasts, but like, I just remember sitting around my kitchen table, like it was a Mayo case of a 10-year-old, but I just remember sitting there looking at a case and how every different professional sitting around the table from like osteopath to PT to oral surgeon, airway dentist, RDH, me, like vision therapist, like we all saw something different on that patient, but it was all such valuable information that was like so critical to the treatment plan. And it really helped us figure out, okay, what first and what is our approach going to be? And then if we see X, we're going to do this. If we see Y, we're going to go this direction. And, and I know that's like in a perfect world and we don't all get to do that all the time, but it's just like the beautiful, perfect world scenario that lives in my brain. And I'm like, if we can all just do that, that would be great. But that is nice that you're able to collaborate. So do you have a lot of those professionals available, like, accessible, I should say, where you work now?
Yes, I'm super lucky to have other pediatric PTs and OTs. And at our hospital, our OTs and our speech therapists do feeding. So I'm able to do co-treatments with them and we can get more eyes on the little ones and again have different perspectives and just all learn from each other and grow and make sure that all of our patients get the best care.
I love that. I love it. Well, I'm so excited for you. I mean, like you're so early on in your career, but like you're so far already. Just because you really jumped in and kind of figured out like, hey, I want to learn more about this. And that's really allowed you, I think, to step further into this space. Probably like, even though you're 2.5 years like out of school now, out of grad school. Yeah. I'd say like, I feel like your skills, because of the populations you work with, could arguably be, in the pediatric feeding space and other, other spaces you've worked in, could arguably be more advanced than someone who's been in SLP for 10, 12, 15 years, just because of the exposure and the mentorship and the coursework and the patients you've had. And, and I think that's what we also need to kind of recognize and appreciate in the field as well, because I think that, it used to be very, ageist, where it's like, well, I have 15 years of experience, so I'm superior to you. And I was like, chop that off right now. Like none of that. We don't have that here. No, like it's not a competition. Number one. Number two, just because you've been in a field longer doesn't mean that you have more experience in a given area, and yeah, so I love making things more accessible so that, opportunities like what you've had, being able to step into ped feeding so early in your career, are there. And you can really choose like, hey, do I want to do this or do I want to go a different direction, and have that information accessible. So I get so excited when I see like, when I see graduates from the course and you guys are ped feeding therapists, and like, I know you do other ped work too, but like, it's so cool to see the evolution.
Yeah. And I'm so thankful for the course. I mean, I think the timing was perfect, and I think it was just meant to be.
Yeah.
And yeah, I couldn't be happier where I am.
Well, thank you so much for sharing your journey with us and all of your, thoughts and advice, even for other therapists who are newer to, I mean, this really applies to like any space, it's not just ped feeding. It's the kind of advice that whether you're a new therapist or you want to go into a new specialty within the field, I just think it's good to hear and to like have that encouragement from like, someone who's done it and has lived through it, and and you're like kind of on the other side of it now, and you're like, okay, like I'm still learning, but yay, like I can do this. So congratulations. It's awesome.
Well, thank you for having me. It was a pleasure to be here.
Thanks so much for joining me. Thanks for listening to this podcast. If you want to hear more of these Myo, Tots, airway, and feeding related episodes, be sure to leave a review on Apple Podcasts or pledge a small amount on patreon.com/the Untethered Podcast. If you found value, others in this space will too. So be sure to share this episode on your social media platforms, and join us over on Facebook, on my Facebook page at Hallie Bulkin Biz, on Instagram at Hallie Bulkin, and you can head over to theuntetheredpodcast.com to grab a copy of the show notes, where you can also subscribe to be kept up to date on the latest podcast episodes.